Right, well, you've heard some fantastic speakers this morning, so I'm not going to repeat what they've said, I hope, and where my slides overlap, I will move on fairly quickly. But I just wanted to start by reiterating what Ailsa said at the beginning about the importance of the North West going back over many, many years. Andrea was in Liverpool when we were campaigning for the smoke-free laws, but the North West as a whole responded massively to that, and it helped actually change things. And I hope you will continue to follow that legacy forward going forward, because it's so important. The tobacco and vapes bill will lead to the end of smoking, but how quickly it will be depends on how much we can accelerate progress. And key populations will be left behind unless you have a comprehensive strategy which doesn't just help people who come to you wanting to quit, but motivates them to try and ensures they use the best methods possible, whether within the services, which can only ever be, as Sarah Jackson said, a tiny part of the total, or outside of them. And a sub-regional programme of the sort you're discussing can drive change at pace for all populations. This is a graph showing just what the differences are across the deciles, and you can see that the most deprived will only hit 5%, the government smoke-free target, 25 years later than the most advantaged populations, and we need to narrow that gap. Oh, I seem to have switched it off. Sarah Jackson talked about this, so I won't go over it again, but we need to ensure that people try to quit and use the most effective methods, and the stop smoking services are not going to reach everyone, whether they're in the NHS or in local authorities. These are the methods that are actually really important, and again, they've been discussed by Ailsa. I'm not going to go into them in detail here because we're running out of time, and I want everyone to get their coffee before we go into the really important next stage, which is discussions. But what we can see across all the regions is that where there's been a regional programme, the effectiveness and the rate of decline has been far highest. And the North East, which has had that programme in place since 2005, you can see has had the most decline in smoking prevalence from having had the highest rates in the country. But the other areas, including the North West, which for some of that time have had regional programmes, have done better than the areas in the Midlands and the east of England and the southeast where there's been nothing. Why do system-wide programmes bring benefits? Well, they bring benefits because there are economies of scale. You can amplify local activity through coordination. You can provide a hub of expertise, take a targeted approach to disadvantaged populations, and carry out the evaluation and the system-wide synthesis of what works best that can only really be done at regional level, and collectivise your risk. If you're doing everything individually, it's more expensive, it's less cost-effective, and the risks that you won't get it quite right are much greater. So, what is the purpose of the sub-regional model? It's to ensure there's coordination across the region, a supported network across the NHS, local authorities, public health, and other functions. The police, fire, customs, they're all really important. And the illicit trade, at regional level, it's much easier to address, and as I'm sure Kate can testify to, because if you're just dealing with it in one local authority, you just drive it elsewhere. And the illicit trade is absolutely crucial when it comes to reducing health inequalities, because who buys illicit tobacco? The poorest people in your communities. What is the price? It's about half the price of legal tobacco. What does that mean about quitting? Well, as Sarah Jackson pointed out, price and affordability is an absolutely key driver. The more expensive smoking becomes, the less likely people are to do it. An action at place coordinated and amplified across the system is always going to be more effective, as shown by the experience in the North East. Effective delivery, an agreed set of functions to be delivered across the region, functions to deliver economies of scale, amplification locally, but not replication. Where things can be done jointly, it will be cheaper if you do it together. and inspire change. Give your leaders a voice to champion action across the system. And champion action nationally. I mean, we were talking earlier about the vote and the numbers of MPs, particularly Conservative MPs, who've abstained or voted against. Your campaigning in the region with your MPs can make a difference. I mean, I was pointing out to Councillor Giddens earlier what happened in when a local councillor from Hull, who was the lead on public health, approached Ed Davey, leader of the Lib Dems, who was going to vote against the bill. He'd been very clear about that. He voted against the smoking ban in 2005. He's voted against every anti-smoking legislation since then. She went and talked to him about her personal experience. Her husband died of a heart attack suddenly because of his smoking, and she's got COPD. He voted in favour of the legislation at second reading. That's the difference you can make through approaching your MPs, through engaging them about the importance of this for their communities. And as I also said, there's no time to waste. You know, the smoke-free generation legislation is a major opportunity. The amount of interest there is in this in our communities is massive. In our media, you know, that means there's more opportunity for what's called earned media, where you're not just paying for advertisements, but you're engaging your newspapers, your regional and local television and newspapers and radio in actually the discussion, because that's what motivates people to quit. And sub-regional collaboration can maximise that opportunity. So show leadership. Where you haven't already, do join the Smoke-Free Action Coalition. We work to coordinate across the whole of, not just England, but actually the whole of the UK, to engage people and help, again, synergise and synthesise the evidence of what we know works. So thank you.